Good morning, everyone. Welcome to our second live webinar in the lead up to the Tech and Gov Virtual Expo. My name is Benson. I am the producer for the event, which will be on the 3rd and 4th of November this year. Today's webinar is presented by Tony Kitzelmann, who will be talking about delivering a secure online healthcare service to Australians during COVID-19. Today, Tony is the Australian Digital Health Agency's Chief Information Security Officer, and he's also the General Manager of their Cybersecurity Centre as well. Tony leads the team of cybersecurity professionals responsible for the security of the My Health record system and the agency's corporate networks. So this webinar will be running for approximately 20 minutes, followed by 10 minutes of Q&A. If you have any questions throughout the presentation, please type them out at any time in the questions tab at the bottom of your screen, and Tony will address them towards the end. So without further ado, I would like to welcome Tony Kitzelmann. Over to you, Tony. Tony, I'd just like to have you unmute your microphone. Awesome.
Excellent, thank you. Thanks, Benson, and thank you for the kind introduction. And first of all, I'd like to thank everybody for the opportunity to come along and talk about what the Australian Digital Health Agency is doing in this challenging time that we're all operating in, and give you a little bit of insight into what we're doing, what we're seeing across the ecosystem from a digital health landscape, and also things that you may be able to take on board to help secure your health practice. So first of all, this is a great opportunity for myself and the agency. We're very proud of the work that we do with the healthcare sector, noting especially in this time around COVID-19 the great work that the men and women of Australian healthcare services are providing to our country to look after our citizens. It's important for us, and we are first to acknowledge that our role is here to do whatever we can to support those frontline healthcare workers that are doing this awesome role. So today's presentation will just give you a bit of a journey through the agency's role, what we're doing in cybersecurity from an education, what we're seeing from a cyber landscape perspective, and also talk about a few things that we offer as part of our service offering that you may want to consider as technologists working inside the health space, or actually in any space where you could leverage the work we've done and potentially help us promote our ethos around cybersecurity being the ultimate team sport. We're only successful if we all work together on achieving a secure digital ecosystem. It's a little bit of a milestone journey for what's been going on with the agency for the last 4 years. So back in 2016, the Australian Digital Health Agency was founded and established as a government organisation to take the lead for delivering digital health services and providing frontline support to those people out there delivering. You will recall back in July 2018, the commencement of the opt-out period, where Australia was asked, if you don't want a My Health record, that you have an opportunity now over the next 12 months to opt out of the system so that you can use your right as an individual to express your focus on how you would like your health records dealt with in the future moving on. It was an awesome January of 2019 when we seen 22.5 million Australians get their first My Health record, a phenomenal achievement for us as an agency, and we were so proud of the work that was done leading up to that. What we seen there was over 92% of the Australian population actually got a My Health record and had the ability to have that data that they need for their healthcare available for frontline healthcare providers around the country, anywhere at any time. And for me, that was a really important day when we actually flicked the switch over and seen that come on board. So during that time, the agency has always had a very strong focus on making sure that its systems are the best of breed and secured, and we do everything we can to protect the data of our citizens. We acknowledge up front that it's not our data. The data belongs to you and myself and my family and your families, and it is our obligation as the custodian of that data to make sure that it's well and truly protected. We did a lot of work in those early years about setting up a cybersecurity centre. We now have a dedicated cybersecurity centre with operations staff. We have our exceptional engineering team that look after the digital security design of our technologies. We have a very awesome education team, and I say that honestly because they're the folk that developed this presentation. But building these outreach programs that allow us to reach out and actually start talking about, well, what does cybersecurity mean and how do we actually work together? So you'd all
Tony,
recall, yes, mate.
Tony, sorry, I apologize for bothering you. Did you want to share your screen, or your screen isn't actually shared at the moment?
I'm hoping that was sharing this entire time. Let me quickly jump across.
Sorry about that.
Let's try that again, folks. Okay, so I'll just go back. All right, so can you see that now, Benson?
That's
Thank
good.
you.
Thanks,
Sorry about that, folks. I actually
No.
thought the screen had been shared previously. So yes, so as you can see, since 2019, when opt-out completed with 22.5 million people, we've then rolled out to January this year, where we've seen the first outbreak of COVID in Australia, and the country stand up to do what is needed to provide an emergency response plan to support the health of Australians. The agency looked at that time when it was occurring. We were getting a lot of feedback from our stakeholders that they needed there were gaps in regards to things like telehealth and opportunities for the agency to take a bit of a lead and help promote some of these digital services. So one of the early things that we did as an agency, and this came out of my branch on the Cybersecurity Centre, is we actually published a guidance material around how to actually use telehealth services, and that went out in June of 2020. And back in March, we've seen incentives around telehealth being rolled out to healthcare providers so that they can actually engage with Medicare for billing of telehealth services. So that allowed people to actually get that healthcare they needed, but without necessarily going into a frontline position like a doctor's surgery that may have people in there with infections, or simply that they didn't want to travel because they may have potentially picked up COVID. The agency also considered some of the more broader challenges and actually went out to the entire industry sector and issued an innovation challenge where we invited anybody in Australia who had an idea in regards to technology options that would help deliver safer to healthcare services in the COVID-19 environment back in May of 20. And that was a really good opportunity. We had an overwhelming response from the sector, with dozens and dozens of organisations coming back with great ideas on things that the agency can do, and that has actually formed part of our 2021 work plan on technology initiatives we can do. And they range from a lot of things around the telehealth services, around e-prescribing, and really nicely linked into the My Health Record platform to pick up additional ways that we can use the data inside the My Health Record system to provide insight for consumers and healthcare providers around what needs to be done to keep people safe in this challenging time. May of 2020, in response to everything that was going on, we realised real quickly that there was a lot going on within the health sector, and that the frontline workers were getting exposed to varying levels of phishing scams and numerous cyber-related events that actually had the catalyst for us to deliver early our e-learning training package. So we've launched as an agency through my branch a digital health cybersecurity awareness learning package. We're already in excess of 1,000 people have connected on and completed the 5 modules that teach you everything from how to deal with ransomware, how to deal with and educate your staff around phishing, right through to the importance of backups, password security, and all those things that as technologists we take for granted, but frontline healthcare providers may not be front of mind for them. So we're very committed to working with the sector. We've received an overwhelming response in regards to that, and continue to tune that material to ensure that we can make sure that healthcare providers and frontline service providers out there are given the tools they need. The Secure Telehealth Consultation Guide, which we produced, is a really awesome document. We built it in partnership with one of our industry partners as a bit of a public-private venture. We both realised there was an opportunity to jump out and say, hey, this is really important. There's people out there delivering telehealth services, and they're not absolutely 100% certain on what they need to keep people's data private and protected. So that guide that we've produced, and later on in today's presentation, I'll talk about where you can get that from, gives common sense guidance. If you're a healthcare practitioner delivering telehealth services, the things that you should consider. It also evaluates some of the core products that are out there and what they do well, and where there are opportunities for improvement. So in regards to telehealth consultation support, safe care delivery, what a lot has gone on. We've seen over 900,000 allied health consultations out there, and this is data is growing every day. 985,000 mental health consultations. We understand the importance and challenges in life, and the healthcare services are providing an awesome job. It's challenging for folk to be stuck at home in these environments where they don't have the normal social interactions, and mental health considerations are something that are important and a part of the whole a way the health sector approaches that whole sense of looking after an individual. 1.4 million specialist appointments, 9 million GP consultations, and 12.5 million total consultations across the COVID-19 theme. The agency's not delivering these consultations. This is done by the healthcare service, which we've been set up to support. And we're proud to do anything we can to enable those 12.5 million consultations to occur and give people guidance and maturity to deliver safe and secure services for their patients. So what have we been seeing in the last 7 months across the health ecosystem? It has been a busy time. From an early stage, we've seen an early uplift around the COVID-19 themed phishing attacks, and they've ranged from simple phishing scams through to complex whaling activities where we've seen very targeted, complex, sophisticated phishing scams being activated around the COVID-19 theme. I would be surprised if there's anybody on this call who hasn't actually come across one themselves. I don't know if I've seen a dozen, I've seen 2-3 dozen just directed into our agency. It's the threshold that is there, it's pushing across, and it's really quite complex. There's a lot going on. Obviously with the pandemic, where there's opportunity, bad guys will always try and do something to rip people off. It's not something special to Australia, it's not something special to the health system, but it is a reality. And the fact that we've seen over 3,060 coronavirus themed scams running across Australia in the last 7-8 months is amazing. It's just astronomical, the numbers that we're seeing out there. And people are getting caught with the same old stuff that we've seen previously, whether it was an ATO scam in 2017, a scam from the AFP where people were tricked into clicking on a link in regards to a speeding fine or a warrant. The bad guys have simply just adjusted their profile and taken advantage of the coronavirus and what's going on there. And we've lost over $1.3 million in losses, and that's a staggering amount of money coming out of Australians' back pockets because of what's going on there. Of course, we see MyGov always getting walloped, people continuing on in regards to trying to harvest credentials around MyGov, and that seems to be a focus point for us. From an agency perspective, we're very interested in those activities because they have a direct correlation to access to the My Health record system, and we put a lot of effort into understanding exactly when people's email addresses change, when people's access profiles change, when they start linking to other accounts, so that we can use them as trigger events in regards to potential unauthorized access to the MyGov system. MyGov team work awesome. They work with us actively, and Services Australia provide us wonderful intel into what's going on out there. But it continues to be a focus area for us in the agency, but also for the broader government services. Medical centres, unfortunately, are coming under attack, and we've seen continuing attacks in regards to cyber criminal activity. Ransomware, last year we've seen a lot of activity focused in the health sector. You would have seen lots and lots of activity down in Victoria and through the media. And Victoria wasn't alone, everybody was getting it, but this year we've seen quite a significant change, and the upping of the ante in regards to ransomware attacks to try and create a disruption to healthcare services is front of mind, and we continue to work with our partner organisations to identify and respond. I think everybody would have seen the ACSC Health Snapshot Report of 2020, and it noted a significant increase to the threat to healthcare systems, whether that be nation states, cyber criminals or hacktivists. We see ongoing activity where our healthcare systems are coming under attack, and the government has done an outstanding job in responding to, but also to be being open and honest about what we're seeing and providing that response out to the sector and acknowledging that we have to work together to resolve it. And last but not least was the 450 World Health Organization email addresses that were compromised and the passwords for those accounts, along with the thousands of other working in the health sector. And it just shows you the level of focus from a global pandemic perspective that the COVID-19 is here. It is the real world, and our health systems, like anything, are targeted for bad guys and the operations that they take on against this particular sector. So what has the agency done, and what do we continue to do? Look, to bring it in simply, we realise that our role is here to provide that ongoing support to the sector, and we've acknowledged that without a concerted approach towards developing products and services to support the health sector, we will simply fail at this. So we've developed a numerous bundle of publications under our education program, and I'd encourage everybody to take the chance to have a quick look at it. Jump on and download the content. If you want hard copies of it, please connect on the link there. And send us an email with the details of your organisation. We'll arrange to get it out to you. We are so passionate about education as being one of the major levers that will help us move the needle in regards to cyber resilience. Our publications cover everything from ransomware, a technologist guide, through to ransomware, a guide for executives, things that you need to understand, the importance of backups, importance of patching, questions to ask your IT vendor if you decide that you want to use an outsourced service provider. All too often people say to me, well, how do I know what is good? How do I know when the vendor that I'm actually selecting to look after my technology is going to do the right thing? And we thought to ourselves, well, you know what? It's unfair of us to think that healthcare providers are going to have the knowledge from a technology perspective to ask those questions. So we developed a guide and a checklist that you can ask your vendors, and it'll say, how do you manage our backups? Where do you store our backups? How do you protect our systems from a resilience perspective in regards to patching, and those opportunities for those questions to be asked and also be woven into the contract deliverables. We also understand, importantly too, that protecting healthcare businesses is a role that we all share. So we published a guidance material around that, so that healthcare practitioners, specifically practice managers who sit in a GP clinic trying to keep the business moving along, have something that's sensible in front of them that provides that clear guidance on what they need to do so that they can continue delivering services. And then right through to simple security and privacy tips that you can use with your My Health record and at home, and security behaviours and practices that as an individual you need to consider when delivering services. We are very committed to the fact that cybersecurity is the true team sport. Without the support of everybody out there in the health sector, without the support of the technologists who deliver the services supporting the health sector, without those partnerships that work together to provide that sense of team sport and consistency and connection, we would fail. So we actively promote and have a very good threat intelligence sharing program that we offer to the health sector, where people can connect up and share and consume health threat intelligence services from us. And our thoughts and aims of that were simple. We'll provide it free of charge on everything that we see, on the hope that you will call us up if you see something in your environment that you think isn't just quite right. So it gives us the opportunity to understand what's going on across the broader ecosystem and provide timely and effective support to our 60,000 plus organisations out there delivering healthcare services to the country. We remain committed as cyber professionals that our role is here to support this unique sector and help them achieve the outcomes around delivering healthcare services in there. So Benson, that's the end of my presentation, and it's an opportunity to open up to Q&A. So I might hand back to you and stop sharing my screen so that we can have a quick chat with the folk on the call.
Thanks very much, Tony. That was a very insightful presentation there. I think what I saw last night on the news was the phishing scams. It's very common nowadays with COVID-19, definitely targeting a lot of vulnerable people, especially the ones, for example, who aren't very proficient in English. They might take advantage of those kind of people in these tough times. So we do have a question here from Hassan. This is a general question. I represent an Indigenous ICT organisation based in Sydney. My query: does digital health have any specific plans to reach Australian Indigenous communities, whether be it in the city or remote location?
Absolutely. Thanks for the question, Hassan. We're committed to meeting the needs of all of Australians, whether it be Indigenous or new Australians, and understand the importance of that. So we have an active program around delivering healthcare services to remote locations and Indigenous communities. We acknowledge the first people of our great country and the importance of making sure that our healthcare services that we deliver from a digital perspective are tailored, because we each take messaging uniquely. And when Benson was talking about new Australians coming in and English not being the primary language, it's important that we acknowledge that. And I think back to when the My Health Record opt-out period came out, I think we had something like 20 or 30 guides that were published around how to use your My Health Record safely in all the different languages of that Australians actually have. So it's something that we are very cognizant of the importance, because messaging is important. Not everybody takes on those messages the same way. But specifically back to your question around Indigenous health, it is a predominant focus. We need to close the gap as a country to ensure that all our people are looked after. The agency is very committed to that, and we acknowledge the importance of that great work. Some of the stuff that I recall about 18 months ago was listening to our Chief Executive Officer talking about a trip that he did out to Alice Springs to a remote community where they were delivering telehealth services to a community that only had a bus that could take 18 people into Alice, and people were missing out on services because they simply couldn't get on the bus to get into Alice Springs. So they brought the healthcare services out to the community so that everybody had that opportunity. There's a lot to be done and a lot of things that we need to do together, but at least I'll say as Australians, we all dig in and acknowledge the importance of looking after each other and just get on with being fair dinkum and finding ways to deliver health services differently to different people's needs.
Awesome, thanks Tony. And we have another question here. Given rise in AI and next steps in telehealth coupled with ominous foreign cyber attacks, what plans are there to 1, apply more of AI in telehealth, and 2, address foreign cyber attacks?
Okay, so I'll talk to the AI in cyber, not so much telehealth, because that's not my subject matter expertise, but we've acknowledged already at the agency that with the uptake of artificial intelligence and machine learning across the health sector, and the fact that the bad guys are smart people, they're adopting the technology already to help accelerate their attack profiles into our sector. So from our perspective, we acknowledge at the agency that, and we have a work plan around this already, which is around leveraging artificial intelligence to help us do predictive analysis on future attack profiles against core products like the My Health Record system. And we work very closely with the Australian Cyber Security Centre and the Australian Signals Directorate around how we can leverage these technology advances to our benefit. One of the programs that we issued about 18 months ago, we kicked off was a user behaviour analytics. Now, whilst it's not an AI activity, it does touch on the importance of understanding changes around user activity. So we kicked out a program called User Behaviour Analytics, which baselined what was the norm for delivering healthcare services and accessing the My Health Record, and using that as a way to do predictive analysis when people's change in their behaviours and access to systems occurred. AI will play a future part in the delivery of cyber services for the country and globally. Only a fool would think that we can do it by having analysts sitting behind a keyboard and chasing these large, vast attacks, because they're getting larger, and AI plays a critical part. So anybody who's working in the STEM environments where they have an opportunity to contribute to AI, please think about us in the cyber world. We need your support. We need to be able to get AI to a point in time where it's actually going to be meaningful, and it can actually be a tool that we can use in anger to protect our systems. I'd like to think that in the next 5 years, that AI will almost probably deal with well over 95% of all day-to-day cyber operations, and our talented engineering and cyber people will be responsible for dealing with those 5% of unique functions out there that are high risk and are quite complex, where they can use their skills. A lot of the stuff that we're seeing at the moment is volume crime, and volume crime is easy to map and profile and build out. So it'd be very good to see where that goes from there, Benson.
Awesome, thanks, Tony. We've got a question here about the format of conferencing. Why is telehealth classified as audio conferencing when globally it usually means video conferencing? Is there a timeline when video conferencing will be the norm?
Well, I'm actually seeing telehealth services delivered by video conferencing, and I think it is actually the norm. Only reason I say that is one of my staff had to get his COVID test and needed to get a referral, and he had a video conference from his lounge room with his kids running around in the background screaming, and had to engage with his healthcare provider via a video conferencing software off a laptop. So I think it's here. I'm sure that there are people still out there delivering telehealth services as a audio only function, but I'm seeing more and more of it, from my perspective at least, as a fully enabled video function, interactive, where I get to see the doctor and engage with them on a screen.
Okay, awesome. And also a question here from Tanuj. Also, with current policies, I believe everyone is unsure whether telehealth will be indefinitely covered by Medicare. Can you shed some light on this?
Unfortunately, my friend, I can't. I really don't know the answer to that. Like I said, I'm a cyber guy. I'm the first to admit I'm a bit of a nerd. But when it comes to that, look, I think the reality is that if we were to look back 5 years ago, there'd be small adoptions of telehealth services. As a citizen, I look at what's going on across the country. My local GP, I was talking to him the other day when I went in for, believe it or not, a COVID test because I came down with the flu and I worried that it was. Fortunately, it was only man flu, so pretty serious stuff. But he said to me straight out that he's delivering more telehealth services than he was delivering face-to-face. I think now that we've seen that it actually works, I think in my personal view, it's part of the fabric of what we're going to be delivering services moving forward. But that's really a call for government and how that changes with Medicare. So I think watch the space with interest. If you think that telehealth is something that you'd like to see supported, let your GP know. They're the ones that are going to represent you with Medicare and that in regards to keeping it as a service offering.
Okay, and Tony, what do you believe is the key role that the software industry can bring in collaboration with ADHA?
The key thing the software industry can do for me, which would make my life so much easier. And it's a great question because I'm passionate about this. As a software industry, you guys are the experts. You deliver services to your customers. Work with us to deliver secure services so the burden of securing the technology moves from the healthcare provider to you as the software vendors and the hosting services so that we as an agency and the technical community out there supporting health services can partner to deliver this. To be honest, it disappoints me that when I sit out there and look at the opportunities available to deliver technology into the health sector, that we're not doing more as technologists to enable this important function. We're the brains trust when it comes to delivering technology, and if we work better together and creating platforms that the health sector could pick up and use and not have to worry about, do I have to back up my data? What happens if I get a ransomware attack? Do I have multi-factor authentication set up on my application? These are all the things that the software vendor community can help me to help the health sector, and I need your help. I'm sincere about this. We want to be better at what we do. We want to deliver things that are meaningful, that take the burden of running technology away from healthcare provider organisations and allow them to do what they're paid to do. These people are exceptionally smart. They're passionate about looking after folk, and somehow we've forgotten that it's our role as technologists to give them services that they can use to deliver what they need to do. So if you want to work with me and find a way to be better around it, let's do it together, because partnership is the only success. The agency remains committed to working with its partners. We want secure platforms out there that actually make it easier for people to deliver health services. So reach out. We have an active program on this. It's important to us because we can't do it ourselves. We know that innovation will always come from the tech sector, and we want you to be innovative and use things differently to deliver services.
Tony, just a question here from Peter, and just would you be able to emphasize more on the best telehealth software solutions that are currently used?
Oh, look, Peter, I'd love to, my friend, but I'd have to go and open the publication guide and read through it because I've read it once and cleared it, and I would not be able to call off the top of my head. But if you go to the second last page of the document, there's a table on the bottom corner. More importantly, go to australiandigitalhealth.gov.au. Bottom of the page is security. There's a little tab there called security. Click on that and all of our education material is in there. If you can't see the link on the bottom, go to the search bar on the top of the agency's website and type in telehealth, and it'll bring up a whole pile of guidance material around the use of the products. And that last page will be in there about it. Remember
Awesome.
that we're not advocating a specific product. We're simply drawing out that certain products have different advantages, and it covers things like Zoom, Teams, the old Skype product. There are a few in there that we cover off on. There's also a link in there as well to the NSA guide where they published more detailed information about the use of telehealth services and platforms that were out on the industry.
Thanks, Tony. And we just have time for one more question here. Will ADHA have more standardization across all layers of digital health, public and private sectors?
I'm not going to say the word standardisation. I think the important word we need to understand across the digital health section is that it is a large and vast ecosystem, and a lot of things happen in isolation of others, but then a lot of things are connected. So we're looking towards harmonisation as opposed to standardisation. And before everybody rolls their eyes and says, oh, that's just public service talk, well, it's not. It's not a fact of setting a single standard that makes you have to follow it this way to deliver secure services. What we're asking for people is to deliver secure health services, we need you to harmonise your thinking about management of risk, understanding of the controls that you need to put in place, and what is contextually appropriate to you. We're more aligned to developing a framework that actually talks about a maturity model, that we don't care where you start, but we want you to move up the ladder to deliver services for your consumers, healthcare provider organisations. And whatever standard you specifically pick, align it and understand the risk that you're taking on board. So that remains our focus. It would be unreasonable of the agency to say this is the standard and everybody shall follow it, because that is just disrespectful. But what we are saying is understand your risk, the context of how you deliver your services, and harmonise where you can, and use things like shared identity management services, shared risk management frameworks, and where possible, adopt international standards. I'm a big fan of picking ISO standards because they just give good solid common sense guidance. But whether you use a NIST framework or an ISM framework around maturity, it doesn't really matter to me. I just want you to start the journey with me and be more secure in delivering services.
Thanks very much, Tony. We do have a couple more questions, but unfortunately that's all we have time for today. I will actually send you a list of those questions, and if you're able to answer them via email, I can make them available to all viewers. But big thank you very much for the webinar today. I think a lot of us have learnt a lot of good topics for further discussion there. For our viewers, if you want to watch this webinar again, please refer to the Tech in Gov website, where it will be available on demand. Tony will be speaking again at the event on the 3rd and 4th of November, so do register if you haven't already. But yes, that's it for today. Thank you very much for joining us, and we'll see you next time. Thanks very much, Tony.
Take care, everybody. Be safe.